So Loop works in the space of corporate healthcare, insurance and healthcare. And one thing that we find with most companies today is there's a greater emphasis on employee health, especially mental health. It's become a very, it's almost it's become normalized now, talk about mental health. So how do you find health playing a role in a performance review system? Like, is it a dimension, is an employee's mental health or physical health a dimension that can be discussed, or even I wouldn't use the word measured, but at least track to say that, I may have a high performing employee, but if I find that the person is stressed or ruining their health, how do I bake that into the conversation that I have?
I think it's still fraught. What I find is that there are probably about 5% of people who are happy to talk about it. And in those cases, it's easy because then you say, okay, you have not been mentally at the top of your form. You might have had a physical problem, whatever. But I know there was a problem, and then we can factor that in. I think the bigger challenge for us is that most people are still not comfortable talking about it. They would still, in fact, I think just the level of self-awareness is not there.
Yeah.
That I might, in fact, have a problem, and if I could get help, I would get better.
They may not be aware themselves.
And that, I think, is our bigger problem. And there you also get into difficult territory. Like, you do things to make some of these services available to people. Right. But how do you get them to use them without, interfering in their personal lives and their personal spaces?